Which of the following is the most superior vertebra of the spine? A. The atlas. B. The dens. C. The axis. D. The coccyx. The answer is A. The atlas. The most superior vertebra of the spine is the atlas, or C1. This bone sits on the axis, or C2, over a bony process called the dens. The coccyx, or tailbone, is part of the sacrum. How many cervical vertebrae are in the human spine? A. 5. B. 6. C. 7. D. 12. The answer is C. 7. There are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. The mnemonic for this is breakfast at 7, lunch at 12, dinner at 5. What bone forms the most posterior and inferior part of the skull? A. The ethmoid bone. B. The maxilla. C. The occiput. D. The sphenoid bone. The answer is C. The occiput. The occiput is the inferior and posterior bone of the skull. It wraps under the bottom of the skull and forms the base on which the head articulates with the spine. The ethmoid bone and sphenoid bone are housed primarily within the skull, and the maxilla forms the upper jaw and part of the orbit. What is the name for the bony protuberances at which the occipital bone articulates with the atlas? C1. A. The onion. B. The external occipital protuberance. C. The external occipital crest. D. The occipital condyles. The answer is D. The occipital condyles. The bony protuberances at which the occipital bone articulates with the atlas, C1, are the occipital condyles. The external occipital protuberance, external occipital crest, and onion are all part of the occipital bone and serve as the attachment points for various muscles and ligaments. What suture joins the frontal bone to the parietal bones? A. The parietal suture. B. The coronal suture. C. The frontal suture. D. The sagittal suture. The answer is B. The coronal suture. The suture that joins the frontal bone to the parietal bones is the coronal suture. The sagittal suture joins the two parietal bones together along the sagittal plane of the skull. There are no sutures named after the frontal or parietal bones themselves.